Everyone. Thanks for being here today. I have an update for you. Just as a reminder, myself, the city department directors, representatives from city council, and also Pennington County meet every morning at 10 o'clock to discuss the last 24 hours and what's unfolded, any changes. From that, I make a basic update, point in time update for the last 24 hours. So we are continuing our coordination with Monument Health as our primary healthcare advisor on the COVID-19 pandemic. There will be new predictive modeling available soon for the use of, to be used by healthcare professionals and government officials. There are a number of models out there that were made a day ago, a week ago, 2 weeks ago, and there's some growing concern from the professionals, from the mathematicians, that the public is misusing or putting too much faith in some of these models that they're seeing online. But we believe the new modeling will allow for more accurate assessment of disease progression, a prediction of disease progression through our local communities. There's been some minor ordinance compliance issues, probably still in the category of misunderstanding. We've made contacts with a couple of folks, and everything is clear as far as what the ordinance insists they be compliant on. The building permit and land development workload is nearly normal, so that's good news. The construction and the development community is continuing to work. Construction jobs, contracts, bid openings are occurring at a normal pace. Our public safety workforce is healthy, in fact, healthier than 1 year ago at this same time. Less people out sick today than there were a year ago. A lot of precautions being taken this year on the part of our public safety officials that weren't being taken last year. All public civic center events have been canceled through April. Should be of no surprise to anyone. The library drive-through is open. As I mentioned before, there's a slowdown of the availability of materials because they are quarantining those returned materials to make sure that there is no spread of disease through the drive-up window. But they do have 30,000 plus digital downloads available at the Rapid City Public Library. Feeding South Dakota is consolidating their food distribution efforts to one site. That'll be Wednesday, April 1st, tomorrow, 10 a.m. to noon at the Central States Fairgrounds. Their limitations, 1 box of food per family, a maximum of 2 boxes per car, and identification will be required to differentiate between 2 different families. There's been a noticeable surge in food assistance needed throughout our community, and we're asking for people who can volunteer with Feeding South Dakota or Meals on Wheels to contact them either through their website or by calling their numbers. So now, yesterday was the last day of legislation, traditionally known as Veto Day. There were a number of bills passed yesterday as an emergency, meaning that the bills will become effective immediately upon being signed by the governor. A lot of those had to do with election, flexibility, education requirements, and that sort of thing. But the bill that did not pass was Senate Bill 191. Senate Bill 191 would have given authority to counties to declare public health emergency and take actions which are currently now only afforded to cities under South Dakota Codified Law 9-32-1. And this realistically has to do with local government bodies being able to impose actions for the suppression of disease in the community. That is the language in the statute. Currently, cities have that authority, counties do not. And after yesterday's legislation, the session lasted until well after midnight. Counties still do not have that authority. Also, it would have allowed cities and counties to pass an emergency ordinance with only one reading, which is essentially the same authority that the state legislature holds for itself. But that was removed early on from the bill on the advice of the governor's office. Several amendments were made to this bill throughout the day, and finally a House committee last night killed the bill around midnight. Opponents of the bill do not believe counties should have the authority to declare emergencies for public health reasons and to take any actions to stop disease in their communities. Pretty fair to say, most or some of the same legislators don't want the cities to have that authority either, but we do. So South Dakota is not unified in this effort to slow the spread of COVID-19. I just got off, in fact I left in progress, a conference call with South Dakota mayors of cities over 5,000 people, where everyone is voicing their opinion about the legislative session yesterday and how to move forward today. So I don't know if there's consensus yet on what the next move will be, but I think the cities and counties have been absolutely left on their own. And so it's us to realize that rather than complaining about it, we should get to work and see how we can improve the situation. So now I have a little statement that I'll read. The majority of our questions and concerns from the public on what's going on in Rapid City and the government intervention has to do with what the ordinance is and what the ordinance isn't. So the city ordinance recently passed by the Rapid City Council mandated certain business closures in accordance with CDC guidelines. Specifically, the guideline states, in states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed. Our ordinance addresses closing or altering these businesses and activities. A specific list is available within the ordinance that can be found on our website at rcgov.org/COVID. So here's what the ordinance is. The ordinance is a targeted approach aimed to temporarily reduce the places where people congregate for discretionary activity. It is a temporary government regulation aimed at slowing the spread of COVID-19. It is a temporary government action approved by the elected representatives of the people of Rapid City in accordance with CDC recommendations. That's what it is. And what it is not a stay-at-home order. It is not a closure of all non-essential businesses or a pick list of winners and losers or a community-wide minimum distance requirement. It is not a vehicle for employees to lobby to have their boss's business added to it. It is not a democratic process for which businesses should be nominated for closure, or a measure intended to eliminate the spread of the disease. That's what the ordinance is not. We can do nothing in government or as community members to stop the spread of this disease. We're a free country. We go outside. We shop for groceries. We do all of the normal things that are going to allow us to come into contact either with human beings or something that another human being just contacted. The whole goal, as I've mentioned for the last couple days, is to slow the spread of COVID-19, to preserve our capacity in our local hospital systems. This is a statewide issue, not just a Rapid City issue. The scope of the city ordinance is limited on purpose. The ordinance has been in effect 4 days now, and we're already planning how and when we lift these restrictions. This will be heavily influenced by the recommendations of our healthcare professionals. One thing I'm not going to do for you is I am not going to absorb all the information from the CDC, from the World Health Organization, from the local hospital system, from all the other professional medical providers who have opinions on this. I'm not going to absorb all that and then disregard it and give you my own opinion about how we should proceed. This has to be a very educated, calculated measure by government to intervene. And everyone at home right now can do their part by staying home if possible, sending only one person for groceries. Don't take the kids. Don't take the whole family. And certainly don't take the neighbors. Stay alone for a while and get your essentials and go back home. And if you're working, protect yourself at work. We get so many calls and emails from people saying, my employer's not taking this seriously. They're putting me at risk. Well, that person should think about quitting. If they can't talk to their employer about reducing the risk for the employees should go home. Imagine if your boss decided to bring into the workplace a pet grizzly bear and you felt threatened. What should you do? Go home. We're all in this together. There is no more responsibility on the part of government than there is on each and every individual citizen, because the citizens make up the government. So we all have to be responsible. Now, are there questions from the media today?
Mr. Mayor, what's the progress on home rule in Rapid City, and how might that be helpful in pandemic situations such as this?
The question is, what's the progress on the home rule effort that we've been talking about for a while for Rapid City? And how might this be helpful during a pandemic like this? Well, we are so early in the home rule phase that we haven't learned enough about it to know exactly. But theoretically, under home rule, the city could do anything that wasn't already prohibited, specifically prohibited by the state. So if there was no law prohibiting cities from declaring a health emergency, we could do that. If there was no law specifically prohibiting the closing of businesses, then we could do that. So it may give a little more flexibility in dealing with a crisis as well as everyday business. But as we've seen in some states and also in South Dakota, there's also a desire on the part of the state government, specifically the legislature, to systematically preempt the cities from doing their own thing. So it may or may not be of benefit right now. We just talked this morning about delaying that whole effort through the month of April, trying to maybe pick it back up in May or later. So we're not giving up on it. It's still important work to be done. Other questions?
Mr. Mayor, with the homeless population in Rapid City, for concerns from the public, how the city is and other organizations are working together to do their part to protect the homeless population. Could you just recap where we are with city working with other organizations on those who are at risk?
Well, the city is working with organizations that provide food. The city is a financial contributor to the Cornerstone Rescue Mission and some other human service organizations. But there's a portion of the homeless population that is very difficult to protect because we try to protect them all year long, and they have different priorities. Now, whether or not this virus and the economic downtrend that we're expecting and seeing already, frankly, is going to create more homeless people, then certainly we or other community organizations will be ready to provide food and to try to find shelter. Another popular question we get is, why aren't you enacting a law prohibiting evictions? And that's just not within our authority to do. And we don't know at this moment who specifically has the authority to do that. I think if you're a landlord and you're going to evict someone because they haven't paid their rent this last month, I think you're a crummy landlord. You know, a lot of times there's more to those stories. This person may be behind in rent for several months leading up to this point. So I think we need compassion, we need some understanding. We have a large part of our workforce in Rapid City that's employed in jobs making clearly less than $12 or $13 or $14 an hour. And when they pay their rent, they're paying out, in many cases, over half of their monthly income. So when that income is removed because of layoffs or because of government shutdowns or whatever the reason may be, that's going to produce a situation where that person can't get their hands on that much cash at one time to pay the landlord. So work with your landlord, work with your lender, your lending agency, and hang in there a little bit.
So, you know, next city council meeting, you guys will be taking up the non-essential businesses again. And as we learned from the special meeting, there were tons of emails. What kind of regulations or rules are you looking to put in to kind of limit those?
Good question. The question is, since on the April 6th city council meeting, we'll be talking about the city ordinance again, because we've set it up so that the city council will have to reconsider that at about every regular council meeting. Then how will we deal with the public comment? And last meeting we had well over 100 emails where people wanted us to read them, and some of them were very reasonable in length, and some of them were very much along the lines of a master's thesis. So we have put into place an email submission form that we should have up on the website here today, if not tomorrow, that will limit the number of characters that can be used. I think we're looking at about 800 characters, so that we can read each of these emails in a minute or less. And we'll advertise that. We'll put out press telling people what the address is and helping them find the form.
Just to elaborate on the rent thing you were saying. So for the hours got cut and they can't make it, so unemployment benefit, that's kind of along that line. That's like something that maybe we can have another press release to discuss that, something like that?
The question was, I was already thinking of the answer while you were talking, so now I've forgotten the entirety of the question, but it was, go ahead so I can repeat it.
Okay, so yes, I was just wondering, you know, if somebody's was affected by the hours being cut because of the pandemic, and they can't pay the rent, that's something that's, you know, something that they can do with the unemployment.
I believe unemployment benefits would be more, well, here I go again. The question was, people who have been affected financially by the onset of this virus or the closing of businesses and are having trouble making their rent, is there some assistance for them? And so my answer is, I believe along the lines of unemployment insurance would be more for people who have lost their jobs. And so people who have lost hours and are not making enough money, Pennington County Health and Human Services has a program where they can get rent assistance. And there may be a variety of other avenues for assistance, and I would check the Elevate Rapid City website, where they are kind of becoming a clearinghouse for related benefits such as this. Any others? Okay, thanks everyone. See you back here again tomorrow.